Welcome everyone. So now we are going to look at lumbosacral plexus. As you can see, it starts from L4 and ends it into S4. It is combination of lumbar and sacral nerves results into lumbosacral plexus from L4 to S4, and there arises different nerves. Both of them combined superior gluteal nerve, inferior gluteal nerve, sciatic nerve, which gives branch of the tubular nerve and fibular nerve, and then posterior femoral cutaneous nerve, and in the end pudendal nerve. Also there are some other nerves arising from lumbosacral plexus, which we will be discussing in. Okay, so these are complete representation of the nerve: superior, inferior gluteal nerve, posterior cutaneous femoral nerve, piriformis, obturator, quadratus femoris nerve, sciatic nerve, which gives two branches, and the end one is the pudendal nerve. Now let us clear a little bit concept that autonomous nervous system gives two type: parasympathetic and sympathetic nervous system. Sympathetic nervous system has some chains, sympathetic chains, cervical chains, and then in this way, and then some ganglions like prevertebral and paravertebral ganglions. And parasympathetic nervous system gives cranial nerve, 12 cranial nerves, and the 10th one is vagus, which also gives the innervation to the thoracic and abdominal organs. Now, as I already mentioned, that sacral plexus is S1, 2, 3, S4, and giving different branches which innervate the lower limb and foot as well. Now, here in this picture, you can see that this is a spinal cord, and there are also presence of aorta. Now, in front of aorta, there is superior hypogastric plexus, and adjacent to it, there is lumbar plexus, while the lower portion has inferior hypogastric plexus. Inferior hypogastric plexus gives pelvic splanchnic nerve, hypogastric nerves, and sacrosplanchnic nerves. And in this way, there is the innervation of pelvic perineal bodies, and lumbosacral trunk has L4, L5, and sacral trunk has also S4 up to. So L4 to S4 forms lumbosacral trunk. Now, also sciatic nerve is the longest nerve of the body, and it has all the nerves except S4. It travels down back of the leg through the supplying adductor magnus, and divides into tibial and fibular nerve, and then fibular nerve goes down into deep fibular nerve and superficial fibular nerve, and this way it innervates down the leg. Now the organs of pelvis and perineum has some plexus like vesicular plexus, prostatic plexus, uterine vaginal nerves, and rectum supply to the pelvis perineus organ.